Just while changing slides, my name is Eamon Coyne. I'm from Ireland. I'm the MyHealth EU lead. You've heard a bit from the different speakers about the European interoperability services and the services that we're trying to roll out throughout Europe. I'm also the eHealth Member State Expert Co-Chair, and my fellow Chair, Clara, gave a presentation on MyHealth EU earlier. So I'll talk to you, and the title of my presentation is Embedding IHE profile standards and the test tools in the cross-border and national use cases. So I work for the Health Service Executive, and as the colleague Derek explained from Canada earlier, I don't want to talk with my back to you while I'm looking at the screen, so I'm just going to move to the side for a bit. So I work for the Health Service Executive. So basically the Health Service Executive is the National Health Service in Ireland. We operationalise the digital health services on behalf of the Department of Health, who are our parent organisation. They're our Ministry of Health. So it's a large organisation, the Health Service Executive. We apply over 100,000 people in not a big population, so quite widely resourced. And the function that I work in is called eHealth and Disruptive Technology. So basically that's the ICT pillar that delivers the digital health projects and tries to realise the digital health strategy on behalf of the Irish citizens and the healthcare professionals. So in Ireland, we have the Health Information Quality Authority, and what they are is like a watchdog in terms of they assess the capability of the health service to deliver the health services. So they conducted a report recently, and what they recommended is at the core of an integrated health and social care system is that can share information between public and private, national, local, cross-border. It's all based on a standards-based approach and health information and interoperability. It's underpinned by international standards. So it was great to see that stemming from the HICWA report, because what we have done is in the Irish MyHealth EU use case, and just in case there's anybody in attendance that didn't hear Marcello or Clara talk about what MyHealth EU is as a use case, it's one with the patient at the very centre. So a patient is abroad within the participating member state in need of emergency treatment. This is underpinned by EU Directive 2011/24/EU, which entitles EU citizens to continuity of care. There's two use cases currently that Clara showed on her slide earlier that have operationalised, which is patient summary and e-prescription. So the patient presents in the patient summary use case to an emergency department, the shortness of breath. The healthcare professional logs onto the portal in country B. So, for example, I'm in France, I don't feel well, I present, and the healthcare professional can access and request the patient summary through the MyHealth EU infrastructure back to country A, which is the country of origin, in my case Ireland, and request the patient summary. Similarly, my wife is slightly asthmatic. She has a prescription for an inhaler. She loses it. We're abroad. She goes to the pharmacist in Spain. He can log on and can see the active prescription and dispense at the point of care. And my wife can get her inhaler even though she's abroad in Spain on holiday. So in essence, in a nutshell, those are the two use cases. And as we've seen before, as Peter was saying, cross eHealth, X eHealth, the additional domains are coming down the track as per the electronic health record exchange format regulation that has been passed by the Commission, which will be lab results, medical imaging and hospital discharge reports, and the enhancing of the patient summary to include rare diseases. So to address these use cases, we use the use case methodology with the help of IHE. So IHE, and I'm going to name a couple of people here, with the help of Charles Paraso, with the help of Karima and Alexander and the team, we held a number of use cases with the domestic stakeholders from academia, from our own colleagues within health, and made sure that we had the clinical, the technical, and the semantic representatives there. And what we've done is we devised an architecture and data sharing infrastructure that addresses the cross-border use case, but also can address sharing of information amongst the clinical verticals within our own national domestic situation. So when I was having the conversations with the delivery directors to explain what the benefits of MyHealth EU were, I'm saying if we can share a patient summary with our European colleagues, as we've proven in the European test events, then we can share them anywhere within the country using the exact same profiles and standards. We don't need to reinvent the wheel. So it's like a standards-based Trojan horse that we're kind of bringing these international standards to be used within our domestic use cases. And the proof is in the pudding, in the sense that now the National Shared Care Record and the National E-Prescription, we went down the tracks with the support of IHE, developing this and integrating with Europe, and then the national programs of work started to play catch-up. So they are now leveraging the same artifacts and infrastructure that we have developed to facilitate the cross-border use case. So we've seen earlier from Anatina the Swiss CPR blueprint, and this is something that we took inspiration from in Ireland with the help of IHE and Caraval and the team in Caraval. So we modeled our patient summary blueprint on the Swiss one. So we've done this for both patient summary and e-prescription, and for the technical people that's there, it just calls out the ITI transactions that need to be supported by the different actors. So that's modeled out on the blueprint. So if somebody's supplying us a discharge report that's going to be used for the patient summary, or from something that's coming from the GP system, the actors in the architecture that we devised know exactly what needs to be supported when they come to test at our projectathons. And that's just another example of the e-prescription. It was a little bit more straightforward. In terms of the tools that we put in, again, we modeled some of this based on what they've done in Europe. So Art Decor is a tool that allows us to model the CDA template. So that's a reference guide for the implementers to look. So for the Irish patient summary and e-prescription for cross-border purposes, we model the CDA templates in Art Decor. So what I just tried to show there in the illustration is we start off with the modeling it in Art Decor at the very back. And then through a number of iterations that we kind of rolled up the sleeves ourselves, and we modeled the CDA template and the XML. And then we tested against the European test tools for the European projectathons and for the Irish test tools for the Irish projectathons. And then it just displays what is represented back to the healthcare professionals when they retrieve that patient summary or e-prescription CDA template. And then in terms of the IHE methodology, similar to what Anatina was saying earlier in terms of the Gazelle platform that the eHealth Swiss team are using, we're doing the same thing. We called it, I believe Anatina said the reference implementation, we call it the National Test Harness. So what we've done is we've hosted 2 projectathons with the relevant stakeholders in Ireland that facilitate the sharing of patient summary and e-prescription. And that has greatly helped the Irish resources to develop their understanding and work in conjunction with IHE to develop the test tools and bring that community of sharing of knowledge amongst everybody to realize the use case of sharing that medical information. And in the most recent projectathon that we had, we actually brought in some of our international colleagues. We brought in Cyprus and Greece to test the patient summary and e-prescription, even though it was a national projectathon. So it's been very good. And then the intent is with the test tools that when you have these standards and profiles written from the Irish perspective, is that we can use them and reference them in the procurement. So when vendors come in and they need to conform, for example, our national identifier is the individual health identifier. So there's PICS and PDQ transactions that need to be supported as a part of that. So, okay, you say that you can support our individual health identifier, then come and show us on our Gazelle platform that you can support those transactions. So that's some of the methodology that we've used in relation to evolving it into a kind of a test lab certification that can be used in procurement. And then something that's come to pass, and we've seen a great slide about the eHealth Swiss, or the Swiss citizens that can they can opt into a service, they can get control of their data, they can look at the logs to see who's accessed their data. So, you know, the primary focus on the MyHealth EU has been making the information readily available to the healthcare professionals. But I'm 45 years of age, I've never seen one medical record about myself. So where's the patient in all of this? So the patient is missing. And also at the EU level, we have the digital decade target that by 2030, all European citizens should have access to their electronic health records. So time is ticking, and some exemplars are out there, as we said, we've seen from previous presentations. We have Estonia, or we have our colleagues from Canada that have made great progress and matured electronic health records. But in Ireland, we have to play a little bit of catch up. So there's an Irish platform for patient organisations and science and industry, and they're called IPOSI. and they conducted a citizen jury where they brought in members of the public to ask them how they feel about accessing their data and who should have access to it. Unfortunately, in Ireland, our health system suffered a cyber attack, so that kind of damaged a little bit, the trust in systems and health IT infrastructure. So we're trying to rebuild that, but Irish citizens do want access to their healthcare data. So this is something that Clara shared earlier, and as Clara said, it just goes to show that the one thing about seeing common slides amongst the presentations is not that we're copying each other's homework, but that we're all singing off the one hymn sheet. So this is something that calls out what the future state MyHealth EU infrastructure will look like. It will evolve from sharing of patient summaries and e-prescriptions to lab results, to hospital discharge reports, to medical imaging, as I said, but also it will give access to the patient. So if, for example, a patient is abroad in country B, the healthcare professional, for whatever reason, can't log on to the portal B, the patient can show the medical information via their smartphone to the healthcare professional, and it serves the continuity of care, as I've mentioned earlier. And just to say that there's a consortium, and I believe it was on one of Marcello's slides earlier on. There's a consortium at present which hopefully will be successful. That this is not just theory, but the Commission are willing to get behind this, and there's a patient access to their healthcare data consortium. So there's 11 member states involved in preparing that at the minute, and Ireland is one of them. And then the intent in terms of the future state is similar to what Anatina had said, is that with the build-up of standardised, structured and coded data, and I was delighted to hear Stefan say earlier, it gets into the CDA is the past and FHIR is the future. So the intent, the architecture that I showed earlier had an XDS centralised repository, but we also have a FHIR repository, so the two can coexist. And when the CDA documents build up over time, you can extrapolate via MHD or the relevant IHE profiles the information to suit mobile devices or other use cases for patient access. So we've started some of this work already with our colleagues in the Shared Care Record and the National Citizen Portal that's been developed. And again, it's just all in line with the EU Digital Decade target that by 2030, all Irish citizens and indeed European citizens will have access to their medical data. So it's something that Marcello is not here, I can't see him, but it's something that came up in conversation, and it's very true. It's not just about the system interoperability. We're all talking about the profiles and the connectathons, but like more is learned from the engineers downstairs talking to one another and helping one another to develop the standard or pass the test or exchange the information. It's more about the human interoperability. So from working with IHE, what we've done is we've designed a standards-based architecture that can be used nationally and also for cross-border purposes. We have a supporting interoperability framework that starts off with security, privacy, patient identification, sharing documents at a general level, the general metadata associated with that, and then getting into the specific domains. So we've done that. We've modeled the blueprints similar to what we've done with the Swiss CPR based on international best practice. We have the CDA templates, and we've started to embed testing culture and projectathons into our own culture, because as Joanna said this morning, culture eats strategy for breakfast every time. So in our organization, in terms of e-health and disruptive technologies, there's a strong focus on project management and Prince2 and the standard of implementing applications. But sometimes when we're talking about IHE profile, CDA, XDS, FHIR, it feels like we're speaking a different language, but slowly but surely we're changing that, and the education is key to that, and communication. So that's it. As we say in Ireland, Garamila Madagat, which means thank you very much, and my contact details are there. And thanks for the opportunity, and thanks for your time and attention.